with Dr. Urzola, and we're going to be talking about neck lifts. All right, Dr. Urzola, can you just give a quick rundown of your training?
Well, we do different procedures for necks depending on each individual's needs. Of course, the first thing, plastic surgery is something very customized to the individual and each person's needs. So basically, what we do is we analyze each individual's neck, and then we decide which technique can be, more effective. If we have to do a mini neck lift or a full neck lift, or a suture suspension technique, which is with with minimal incisions, very little invasiveness, and basically. Based on this, we decide which technique is better. The great thing about this is that we've been able to master this, procedure very much. So these are procedures that we do in around 1 hour time. Some of them even, a little less time. We do them under local anesthesia with a little bit of IV sedation in some cases. So it's a very fast, procedure with very low risks and very high index of satisfaction in our patients. Because many of these procedures are very minimally invasive, the recuperation time is also very short, and this helps a lot, with people that are traveling from abroad. Our office opens into the lobby of the AC Marriott here in Avenida Escazú. So it's a very comfortable, situation because you can just stay in your room. We can see you directly in your hotel room, and we have all our staff who's on top of organizing our schedules. We have English-speaking nurses who help you with dressings, and we basically have accomplished a system in which, from the moment you arrive to the airport to the moment you leave, everything is taken care of. It's a very safe scenario for people that are traveling. It's also very easy to do it. So
let's go back for a second and talk about, because you mentioned there's 3 different options for neck lifts. So can you walk us through this? Let's talk about, say, the full neck lift to begin with. Like who would be the best candidate for this, and what would that procedure entail, and how long would it take, and how long would it take to recover from it?
Well, basically, again, it will depend very much on the evaluation that we do for each patient. Normally, we do full neck lifts with people who have a very important sagging and a separation of the platysmal bands, which are those 2 bands that you start to see here. Okay. Normally, these patients have, in many cases, fat under their chin. Okay, so we have to sculpt that, take that away, which we do with a laser. Then we do the platysmal repair to join in the platysmal fibers. This is the muscle that's here in your neck, and it goes from the anterior mandible of from the anterior margin of the mandible to the clavicle here. So we tighten that muscle. Okay, and in some cases we need to do a little incision here. Okay, and a little incision that goes right inside your ear, more or less from here and behind. Through these incisions and minimal dissection, we're capable of basically tightening everything, as you can see in the pictures. And this is a surgery that we do more or less 1 hour, 1 hour and 15 minutes stops. In some cases, when we have patients who have lost completely the cervical mandibular angle, which is the angle here between your neck and the mandible, we can use the suture suspension technique, which creates like a fake ligament that tightens everything from there and defines the cervical mandibular angle again. And this gives great aesthetic outcomes. We do this through 3 incisions of more or less 1 centimeter in those patients that are very young and don't have that angle well defined, okay, who don't have skin problem. Okay, so sometimes we just do a little bit of liposuction and do this technique. Within 30 minutes, you will have, you know, a perfectly shaped cervicomandibular angle with really great results and very, very short recovery times.
So how long of recovery time are we talking? Like when you say 30 minutes to do surgery, I mean, my gosh, you always think about surgery being like a whole day and very complex.
Well, for patients that are younger and that only need the suture suspension, the recuperation time is very, very little, you know. But I always like to tell my patients, you know, to keep in mind that they underwent surgery and that, you know, care needs to be taken after a procedure, right? So I always recommend from 7 to 10 days of rest, you know, and there can be some bruising expected, you know, from these procedures, especially in older people because they have more, you know, more vascular fragility. But, you know, these are procedures that have minimal pain, very little swelling in most cases. We don't need to use drains in these type of procedures because of the minimal dissections we do. And something that's very important is that they have long-lasting results, which is something that's, you know, very positive of these techniques that we do. You know, we have, again, accomplished, you know, a very good set of techniques that allows to give this type of quality results.
So now that we've talked about the full neck lift, we've talked about the suture suspension neck lift, and then there was the mini neck lift as well. Correct?
Yeah. When you have people who have a very little, you know, skin sagging, okay, or just like a little tiny, you know, beginning of the jowls, then we do another procedure which we call mini neck lift, which is like a neck lift, but just a little tinier dissection, okay? And it gets that type of problem solved. You know? There's less skin compensation, so we do a very, very little incision, you know, and we basically take care of that area through that incision. Most of the times, we like to repair the platysmal bands because if you give good structure to the midline, and when you tighten the lateral part, it allows for a much nicer and tighter result, which looks really, really natural, okay? And basically restores the anatomy of the platysma in your face. And this is what, you know, gives that very natural look with very, very minimal incisions and very fast recovery times.
So it makes sometimes a very natural look. So it's not like when you go back, it's not, people will think like, wow, you look younger, but they can't quite put their finger on it. Is that what happens?
Yeah, well, in plastic surgery, and especially in facial plastic surgery, you need to be very careful with, you know, not overdoing the results. The last thing you want is to look like you were pulled or like you're in a wind tunnel. You know, that's something that's very, it's very nice when you are able to restore your younger self without changing the facial features of your face. You know, naturality is something that's, you know, of a very big importance in the result of good plastic surgery for the face. You know, so this is something that's really, really, you know, important. We can very quickly take pictures, put them in a software, and generate computerized simulations to more or less give you an idea of how you're going to look. And this also makes people very comfortable because we can back this up with, you know, hundreds of cases before and afters that we have done over many, many years. So this is something very important because you don't want to have fake looking faces, you know, or operated faces. You know, you want to have something that looks natural, that makes you feel much better with yourself. And this we accomplish with basically reestablishing the anatomy of your face by repositioning the muscles in the right place and tighten the skin on top of the muscles, you know. And we do this, you know, in a joint movement. So there's not really a very big separation between the skin and the muscle, which allows for faster recovery.
Okay, so what kind of results, like if somebody said, okay, I'm thinking of getting a neck lift, I'm 45 years old, what kind of results would I be able to expect?
Well, again, it depends very much on each individual's case, right? The first thing that we do is we do a very thorough analysis of the anatomy of the face of a patient, and then of course we open all possible channels of communication to understand exactly what the desire of that patient is. Once we understand well exactly what the problems are, we give all the information necessary for the patient. We of course go through a very thorough medical history, and inform patients very well of risks, possible complications, because in every surgery there can be, and how we resolve them in case there something happened. After this, we basically customize the procedure using, again, computer software and pictures that patients bring. And based on that, we basically decide which technique or combination of techniques is better, to give that natural look and result that the patient wants.
Okay, so can you walk us through, say, Mary Smith is in Houston, Texas, and she's interested in coming down to have a neck lift done. And what would be the steps that they would need to take beforehand, and once they're here?
It's very simple. So we basically just require an email, okay? As soon as we get the email, one of the members in our staff will get back to you with an email, and we'll request some pictures, and the pictures work much better if you send them front, three-quarters, and profile, of both sides. Once we have these pictures, we will set up a Skype or a FaceTime appointment, which is like a regular appointment to when you go to the doctor. You just do it from your computer. So we'll basically go over everything. We'll meet each other on the computer, and then we will, establish a plan. I'll explain everything, or Dr. Jupapa will explain everything related to the procedure, what we recommend. And once the patient is ready to move forward with surgery, we will request some pre-op tests, depending also on the medical history of the patient. But there are some basic tests that we require for safety. And then once we have those, we'll book the surgery time, and somebody will be at the airport to pick you up and bring you to our facilities for a consultation, or to the hotel and then to the facilities for a consultation. They're just like next door, so it's a very simple process. Once the patient is in Costa Rica, we will go through a very thorough consultation, when we will go through everything once again, do the imaging, do the computer, computerized simulation of the results, etc., go over every single doubt that the patient has. That day, all the paperwork and everything is left ready, and the day after, we do the procedure. For patients that have very long flights, we request them to be in Costa Rica for safety 2 or 3 days before the day of the procedure.
What would constitute a long flight?
More than 5 hours.
Okay.
Yeah. And in that case, we can arrange to do the consultation, and then Costa Rica is a beautiful country. You can go see a volcano, do a coffee tour. It's many activities that could be possibly scheduled. And then we do the procedure. In that way, we're sure that to reduce all the risk of DVTs. And although these are minimally invasive procedures and very quick procedures, we like to keep safety to the highest possible standards, and this is one of the safety precautions we normally take. The day of the consultations, our staff gives you basically a list of all the medications that you need to take. We fill in the prescription right there. This has an explanation of what each medication is for, how to take them, etc. And we give you a paper with all the appointments scheduled during your stay in Costa Rica. We can book hyperbaric treatment for patients who desire it.
So what kind of
hyperbaric? This is hyperbaric oxygen allows you to recuperate much faster. because you're basically giving oxygen at very high pressures and quantities to your body. So this is like fertilizer to plants. Hyperbaric oxygen is fertilizer to your skin. So you heal much faster. We also have, a team of physiotherapists, for massages, relaxation massages. So it's a very, very, we really are striving to give you a very nice experience, not only a very nice surgery result, but a very nice experience. And everything is very well organized, And when I'll see you several times after the surgery to remove your dressings, to make sure that everything is okay. And when you're ready to go back home, then somebody will drop you to the airport so you complete your trip.
And how many days? So say if they come in, say 2 or 3 days before they have the procedure, how many days do they need to be here before they can fly again?
Well, this depends very much on each individual's case and the type of procedure, For patients that are a little older who need more work, we ask them to stay between 7 and 10 days, We recommend people to stay at least 5 days after the procedure so we can check that everything is in great shape before we let you go back home. And something very important is patients that are traveling from New Jersey or New York area, they can have their first consultation in New Jersey with Dr. Jim Papa and some follow-up in New Jersey as well.
Okay. So now if they're not, say, in New York, New Jersey, and when they go back home, what do they need to think about once they're back? Do they have to go see their own another doctor?
No, basically once we tell you can go, it's because you're okay to travel and you won't need any more medical assistance. Yeah, this is a great advantage of these, type of procedures that patients normally heal really quickly, And if there was the need to, some follow-up in any case, we'll try to arrange it, and help you with that. Something very important is patients always have access directly to us. They'll have our phone numbers, cell phone numbers. So they can call straight into the cell phone and, we can help them evacuate any doubts or problems.
Now, could someone come down and have this done alone? Like, do they need to have someone accompany them, like a family member or a friend, or are they okay if they come by themselves?
Over the last years, it's, many people come by themselves, many people come with someone to accompany them. We always prefer when people travel, with somebody else, because it's always, nicer to be with someone who's, keeping you company when you're right after surgery. But it's not a requirement, Many people decide to come by themselves. They come here. It's a very nice place to relax, They have a, very nice hotel with, international standards. And the good thing is that there's nobody visiting you or calling you. You're completely disconnecting, recovering, and making sure that you go back looking, great, and that nobody's bothering you during your recuperation time, which normally happens when you're back home. You have to, something happens, you do need to do an errand, or somebody shows up, or somebody calls you. This is something that doesn't happen here because you're, away. And this allows for much, better relaxation time and recuperation time after surgery.
And the location here is a wonderful spot because not only do you have, as we were saying, the International Hospital, literally I can see it right from the window here, but you've got the AC hotel next that is literally 2 steps out from the door here. So if you finish your procedure, you can just walk right into the lobby, like you don't even have to go outside. And then Avenida Escazú, where we're located, there's everything from a Starbucks to a P.F. Chang's. So all the comforts of home.
Yeah, that's the nice thing about this area. Everything is walking distance. We have great international restaurants, we have a Peruvian, Italian, Japanese, organic restaurant, ice cream places, movie theaters. Everything is walking distance, and it's a very, very safe place to be. And to recover for surgery. And we're very lucky because when we started our office here, we spoke with the managers of the building, and they made a door so we could walk from our lobby into the lobby of the hotel because of so many people traveling from abroad, So it makes it much more comfortable for patients because they don't need to be transported, while in Costa Rica. And this, is a very convenient thing. We also have the Marriott Residence Inn for people who come with like their kids, which happens very often also. So they have like more accommodating suites that are a little bigger, like two-room suites with a kitchenette, and a living room. So it's much easier, and because it's a very nice area for kids also,
yep.
If the family comes, it's very easy for the dad to bring the kids around and the mom can stay, resting. So it's a very convenient spot.
Well, or they could even, if someone comes down, they can, because you also have a very talented cosmetic dentist on staff as well.
Yeah, which is something that also many patients do. They come and they do both the aesthetic, surgery and also all the dental part. We have my brother is a dentist, and he has two specialties, one in implantology and one in prosthodontics. And they have a very, very complete group of dentists working with us. So it's also a lot more convenient and definitely a lot cheaper than in the US or in Canada.
So that's the other thing. So the advantages of coming down here is, you're not giving up the quality in any way, shape, or form. In fact, Dr. Giampapa was the creator of the suture suspension neck lift, correct?
Yeah, Dr. Giampapa invented the suture suspension technique, and he's done around 4,500 of these procedures.
Wow.
Yeah, and so there's a lot of experience behind what we're doing. And again, our main concern is to keep the patients safe, give them nice, natural results, and make their experience traveling to Costa Rica really worthwhile.
And just to wrap up, so out of all the different cosmetic surgeries, is it safe to say that neck lift is usually one of the most popular because of it's minimally invasive, but the results are usually...
Well, we do a lot of different procedures, but definitely facial procedures are very requested, amongst our patients. And they have this advantage, like the procedures are quick, are very consistent in the results. They're very safe procedures, very low risk of complications, and very fast recovery times. So you might have a little bit of bruising, but after 5 or 6 days, you can even put some makeup on it, and people, go back with a great shape, with a great change already, and in great shape, which is the most important thing.
Well, I'm going to be, at the end of this, I'm going to be putting some photos up. You can see the before and after, because the change in people's looks is amazing. It's easily 5-10 years difference between the before and the after. And that's just with the suture suspension procedure. So thank you so much, Dr. Urzola. Was there anything else you wanted to wrap up before? Well,
yeah, just tell everyone that we are very happy to have had this opportunity to communicate this office that we have here, and that we're very happy to answer any questions you have. We will definitely try to be as prompt as possible and help you organize your trip if you want to have very good plastic surgery.
Great. Thank you so much. Thank you very much for joining us today. And please, any questions that you have for Dr. Urzola, just drop them into our chat box and we'll get back to you as soon as possible. Here's to a wonderful day, and look forward to seeing you again on another webinar soon.
Thank you.